Tularemia, also known as rabbit fever or deer fly fever, is a bacterial infection caused by Francisella tularensis. The disease was first identified in 1911 by Dr. Edward Francis, an American bacteriologist, who conducted studies on ground squirrels in Tulare County, California. The bacterium was named after the county where it was first discovered. Tularemia can be transmitted to humans through several routes of infection, including direct contact. Handling infected animals, such as rabbits, hares, or rodents, can result in the bacteria entering the body through skin cuts or abrasions. Bites from infected insects. Bites from infected ticks, deer flies, or mosquitoes can transmit the bacteria to humans. Ingestion. Consuming contaminated food or water, such as undercooked meat from an infected animal or water containing the bacteria, can lead to infection. Inhalation. Breathing in aerosolized bacteria from contaminated environments, such as during landscaping or farming activities, or in a laboratory setting where the bacteria are being studied, can cause infection. Contaminated materials. The bacteria can enter the body through the eyes, nose, or mouth if you touch contaminated materials and then touch these areas on your face. It is important to note that tularemia is not transmitted from person to person. The infection occurs only through contact with infected animals, materials, or environments. The symptoms of tularemia can vary depending on the route of infection and the strain of the bacterium. Generally, symptoms appear within 3 to 5 days after exposure, but they can take up to 14 days to manifest. Common symptoms of tularemia include sudden onset of fever, chills, fatigue, muscle aches and joint pain, headache. More specific symptoms based on the route of infection include ulceroglandular tularemia. This is the most common form of the disease. It is characterized by skin ulcers at the site of infection and swollen, painful lymph glands. Glandular tularemia. Similar to ulceroglandular tularemia, but without skin ulcers. Swollen and painful lymph glands are the main symptoms. Oculoglandular tularemia. Infection of the eye, resulting in symptoms such as eye pain, redness, swelling, and discharge, as well as swollen lymph glands near the ear or neck. Oropharyngeal tularemia. Ingestion of contaminated food or water can lead to this form of tularemia, causing symptoms such as sore throat, mouth ulcers, and swollen lymph nodes in the neck. Pneumonic tularemia. Infection of the lungs, either through inhalation of the bacteria or the spread of the bacteria from other parts of the body. Symptoms include cough, chest pain, and difficulty breathing. Typhoidal tularemia. This severe form of the disease can cause symptoms such as high fever, vomiting, diarrhea, and enlarged spleen and liver. If you suspect you have been exposed to tularemia, it is essential to seek medical attention promptly. Early diagnosis and treatment with antibiotics can help prevent complications and improve the outcome of the infection. The treatment for tularemia typically involves antibiotics. Early diagnosis and treatment are crucial for a successful outcome and to reduce the risk of complications. The most commonly used antibiotics for treating tularemia include streptomycin. This is often considered the drug of choice for treating tularemia. It is an aminoglycoside antibiotic that is administered by injection. Gentamicin. Another aminoglycoside antibiotic. Gentamicin is an alternative to streptomycin, especially when streptomycin is not available or if there are contraindications for its use. Doxycycline or tetracycline. These antibiotics are part of the tetracycline class and can be used as an alternative, especially in cases of mild to moderate infection or in patients who cannot tolerate aminoglycosides. Ciprofloxacin or other fluoroquinolones. In some cases, fluoroquinolone antibiotics, such as ciprofloxacin, may be used for the treatment of tularemia, although they are generally considered less effective than aminoglycosides or tetracyclines. The duration of treatment may vary depending on the severity of the infection and the patient's response to the antibiotics. Typically, treatment lasts for 10 to 21 days. It is important to follow the prescribed treatment plan and complete the full course of antibiotics to ensure the infection is effectively treated and to prevent relapse. In addition to antibiotics, supportive care may be necessary to manage symptoms and complications, such as providing pain relief, fever management, and hydration. In severe cases, hospitalization may be required for close monitoring and care.